I will make a short presentation on the contents of our work, fostering participation and knowledge construction processes in real settings through decision analysis and collaborative value modeling, based on the school of thought created many years ago by Professor Carlos Bana Costa. This socio-technical school of decision analysis is founded on the principles of multi-attribute value measurement and the Macbeth approach, together with the principles of process consultation and process design. Macbeth enables constructing a quantitative value model from elicited qualitative value judgments using very friendly protocols of questioning. Collaborative value modeling is embedded on the idea of making use of 𝗿𝗏𝗹 processes that are delivered in a web format and can be empowered by platforms like 𝗿𝗏, with whom we work. And that information can be obtained in an expedite way and be combined with multi-criteria decision conferencing. And this combination of non-face-to-face and face-to-face approaches can lead to better collaboration. Collaborative value modeling can be applied in different modeling stages. I will go through these real applications that were carried out to address the challenges of our clients, and our clients have been very diverse. So the first challenge that has led to the creation of the collaborative value modeling approach was the 𝗷𝗏𝗹𝗏 project, in which we were asked to build a population health model that could evaluate the health in European regions and help designing policies to improve health and health equity. The second real application was to the Brazilian Forum for Climate Change, that had to prioritize measures to reduce carbon emissions. This work was done following the Paris Agreement. Our third case is a corporate case. Galp is our oil and gas company. It had the challenge of selecting an enterprise management system, and so we helped them building a model. Our fourth application follows a project in which we're asked to lead a process of defining which policy recommendations could be followed to improve sustainability and resilience in the Portuguese health system. A fifth application, we have been working with Portuguese hospitals and with our regulator responsible for health technology assessment to work together on the evaluation of different types of medical devices. And in the last case, we were challenged to help people building a national consensus in the field of immunology. So, of course, I don't have time to go into detail in each of these applications. I'm going to select some features to understand how we have applied decision analysis concepts and tools, and of course, collaborative value modeling to answer to the challenges. So, in the European project, 𝗷𝗏𝗹𝗏, we had the challenge of embedding a large number of people in building a model to evaluate population health, and all those people were located in different countries. They were specialized in different areas of population health, and we wanted to use sound methods to inform multi-criteria modeling. And we have devised different types of 𝗿𝗏𝗏 processes to inform indicator selection, select value functions, understanding qualitative weights, and that was set to inform a decision conference with a smaller number of people. In the second project, to help the Brazilian Forum for Climate Change in prioritizing measures to mitigate carbon emissions, we have devised a questionnaire in which we could ask, in this criteria, the added value of this measure is, and using for Macbeth-based qualitative scale with a negative and a positive part. This information collected from a large number of people was the starting point for a decision conference that really benefited from that previous knowledge acquisition. Third case, corporate case, when a company selects an enterprise management system, faces the challenge of setting the features of the system. Here you have an example of a 𝗿𝗏𝗹𝗏 process in which it was used for eliciting Macbeth qualitative swing weighting judgments. The 𝗿𝗏𝗹𝗏 was run in 3 rounds that gathered convergence in participants' views, and after convergence on qualitative swing weights, that information integrated the decision conference in which a Macbeth-based model was built. The fourth case was from the Partnership for Health Systems Sustainability and Resilience. This is an initiative from the World Economic Forum, LSE, and AstraZeneca, and with local partners in Portugal from Philips and KPMG. After analyzing the system, we were asked to set a process to involve a large number of people to find policy recommendations to improve sustainability and resilience, and also to promote a policy dialogue. Given that we have the opinion about the recommendations and the comments, we have combined the 𝗿𝗹𝗹 with dialogue mapping tools. Fifth case, we worked with the health technology assessment regulator in PharMed and hospital partners to help them to reflect upon the added value of different medical devices. I would like to underline the use of collaborative value modeling with features of behavioral research. Finally, very briefly, in medicine, very often there is a need for setting national consensus. And here we were asked by the Institute for Evidence-Based Health to help them. This was a project for the pharmaceutical industry to help designing a process and implementing it so that there was experts' convergence towards full agreement. Final comments about the added value of collaborative value modeling. We believe that looking into these cases, the approach was effective to collect knowledge from a large number of stakeholders. It helped promoting dialogue and consensus. It can be tailor-made to different contexts. It can be combined with different decision analysis techniques. And for sure, in the future, we can develop tools to help its implementation. This ends our presentation. Thank you very much for your time. Our team thanks all the organizations, clients, stakeholders, and collaborators involved in the collaborative value modeling applications. In particular, we would like to acknowledge the significant contribution of 𝗀𝗵𝗏 Costa in the implementation of the framework. Finally, we thank the Decision Analysis Society and the Society of Decision Professionals for the opportunity to share our work.